Thing is, if it's a sprained ankle, for example, we'd be lathering it with arnica and, even maybe some comfrey. There's all of the things we put on the outside as well to help reduce that inflammation when it's visual. But at the same time, we have to be really careful of those visual inflammations, such as in arthritis, because once the inflammation is trying to protect that ruined joint. And so if we reduce that inflammation too much without giving it all the other goodness and the bone builders and, all of the things, all the collagens and all the rest of it, then we're actually going to be doing a bit of a disservice to that person. We really need to modulate what we're doing and really think about, do they need this inflammation, or how much this inflammation do they need, and what else can we do along the way? Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello, everyone, and welcome back to Mentoring with Geraldine and the Bite Size Podcast. And today we've got Christine Thomas from the Herbal Extract Company in Sydney, Australia. And we're going to talk about anti-inflammatories because we're talking about immune health. So the last few that you've been listening to are on immune health. And now we're up to the anti-inflammatory family of herbs. And there's a lot to talk about in inflammatories and anti-inflammatories because inflammation is definitely on the rise in our clients and what we're seeing in ourselves. We're aching and there's lots of inflammation there. So do you want to walk us through some of this, Christine?
Yes. So, just simply that inflammation is the body's chief defense against injury or infection. So they're the two things we're looking at. And it's a signal to the immune system to heal the damaged tissue if we're looking at injury, or defend against foreign invaders such as viruses and bacteria, which is the infection. So, which, has been very topical of late. And when we're looking at inflammation, it can cause a localized redness, as you were talking about with all these aches, redness, swelling, pain, heat. It can cause loss of function of the involved tissue. And, without it, our wounds would fester and infections could become fatal. So it is good in moderation to have inflammation. However, sometimes it can be inappropriate, which is why it's getting a bad reputation. If the process of inflammation goes on for too long, or if the inflammatory process or response occurs in a place where it's not needed, then it becomes problematic. And that's where herbs can come in. Yeah. And there's different types of inflammation. We've got the acute inflammation, such as you see in a sore throat, cut knee, sprained ankle, and that's usually short term and it's usually localized, and it's the normal tissue function. But if it persists for a long time, then we get chronic inflammation. And unlike acute inflammation, chronic inflammation can have a long-term and whole body effect, and that's where probably herbal medicine tends to shine in chronic inflammation. And chronic inflammation can be the result of an infection, an autoimmune reaction, or an allergy. And it's a type of systemic inflammation, and it can cause development of disease such as heart disease or cancer, and can also lead to autoimmune diseases such as rheumatoid arthritis, type 1 diabetes. And again, as we spoke about when we were just looking at the immune system as a whole, healthy diet and lifestyle can help keep inflammation under control. And just if we're looking at conventional therapies for inflammation, steroids and non-steroidal anti-inflammatories or NSAIDs, they have many side effects. And again, it's sort of differentiating herbalists and naturopaths where we look at the cause of an illness and not just treating the symptoms. Simply shutting down the inflammatory process without addressing why the inflammation is present is questionable. And the word anti-inflammatory, when you apply it to herbs, it's a very broad term. So, rather than suppressing the inflammatory response, what we're doing is assisting the body to overcome the problem depending on the mechanism that the body is using to generate the inflammation. So, is it an immune-mediated reaction? As we see in autoimmune, or is it more of a localized swelling, for example, such as in a sprained ankle? So depending on what the mechanism is for the inflammation is what anti-inflammatory herb we're going to use.
Yeah.
All right.
Yep, that sounds great. I mean, because the thing is, if it's a sprained ankle, for example, we'd be lathering it with arnica and, even maybe some comfrey. There's all of the things we put on the outside as well to help reduce that inflammation when it's visual. But at the same time, we have to be really careful of those visual inflammations, such as in arthritis, because once the inflammation is trying to protect that ruined joint. And so if we reduce that inflammation too much without giving it all the other goodness and the bone builders and, all of the things, all the collagens and all the rest of it, then we're actually going to be doing a bit of a disservice to that person. We really need to modulate what we're doing and really think about, do they need this inflammation, or how much this inflammation do they need, and what else can we do along the way? So, because I mean, if I've got somebody in front of me with arthritis, for example, then I know the turmeric and the white willow, but I'm also going to be looking at the boswellia and things like that. So we're making sure, as we've always said, that when the person's in front of us, we're creating that herbal mix that really suits the case and suits the person. And so you've just met,
as you said.
Sorry,
they're great in creams, as you said as well, like externally and internally, and you can mix our fluid extracts into a base cream, and then they can be absorbed through the skin as well. So as you said, it's a great way to get it into the system.
Yep, a vitamin E base cream with the herbs is a great one. And when I'm doing facial creams, so for acne and things like that, I actually put it in a base of aloe vera. So because the herbs mix in so well with that. So we have got that combination. We don't just have to, if you've got an open wound, then you might be putting in tincture in clean water and putting it onto the wound to sterilize and kill any bugs, for example, like you would with an antibacterial. We've got the herbs, we can do that with calendula and those sorts of herbs. We've got the outside and we've got the inside. So some of the anti-inflammatory herbs that you've listed here in your review. So chamomile is so good for everything. I mean, Peter Rabbit's mother gave it to him when he came in having gobbled in Mr. McGregor's garden. Chamomile is so well known, and the only reason for not taking it is if you're allergic to flowers. So it's got a really, really long history of using it for all of these things. And what a list it's got there.
Yeah.
So
yes, and it was really hard to choose. I mean, I've just listed 4, but I mean, there's such a long list of herbs that have anti-inflammatory action. So, because again, a lot of other actions will, like say antioxidant will give a herb an anti-inflammatory action as well. So it was really hard to choose, but I mean, chamomile is a traditional medicine for the treatment of inflammation, as well as, it is calming for the mind, and that Peter Rabbit's mum was using it to help him get to sleep, but also because he had a tummy from eating all the cabbage in the garden. So that is a sign that he had sort of an inflammation there. There was sort of a gut inflammation, and that's where chamomile shines in soft tissue, inflammation of the soft tissue, such as the skin and mucous membranes. So that makes it really useful in digestive inflammatory processes, such as stomach pain and sluggish digestion and irritable bowel syndrome and diarrhea, nausea, but also eczema and skin disorders. So it's a soft tissue inflammation is what you can think of for chamomile.
It's an excellent choice. And we've got liquorice in here. Now, liquorice, taste-wise, we've got the lovers and the haters. It's a bit like the parsley, and what's that other one?
Coriander, is it?
Coriander. Yeah, you've got your lovers and your haters. They're either coriander haters or coriander lovers. And it's a bit like the licorice. I'm always saying to my clients, do you want licorice or do you want ginger? You've got a choice of two here. And so I can't do licorice. It's disgusting.
You always your thoughts, the line.
Yeah. It's amazing. It's so, so we all know about, everyone's seen licorice, everyone's tried licorice. And yet it's amazing for so many things, and it's great to modulate our inflammation, as you've said.
Yes, it's a great ally, especially again for skin health, and again externally as well as internally. So you can, do both. And licorice is interesting as well because it supports the endocrine system, the hormones, particularly when we're looking at long-term everyday stress. So a lot of people think of licorice for the adrenal stress, and you probably think, oh, what's that got to do with inflammation? But what it does is it nourishes the adrenal glands, and this is thought to help produce the right level of hormones, especially cortisol. Now, cortisol is a potent anti-inflammatory that prevents the widespread tissue and nerve damage associated with inflammation. So it's also a key player in stress response, and it will fail to function with chronic stress. So licorice is fantastic because it helps to support the production of cortisol, which is going to help with inflammation as well as stress because they're all intertwined together. It's also great for hot, painful, irritated throats. It's very soothing on the mucous membranes in upper respiratory infections. It's also known for deeper down in the chest for relieving coughs, again with this winter coming up, especially those dry, irritating coughs. It's famous for gastric ulcers in the gut, dyspepsia, leaky gut syndrome, and bacterial imbalance, with gastritis and peptic ulcers with the Helicobacter pylori bacteria, and also in joint pain, the anti-inflammatory benefits. So it's very broad. That's why it's it had to be included in the inflammatory.
Yeah, absolutely. I mean, it's one of the best taste correctors, and I put it in, the children's mixes all the time because that I do actually check with them a lot of the time if they'll take it, but it's really going to cover a lot of your bases with illnesses. And so there is the discussion of not having high doses of it for high blood pressure. But the simple fact is it is so strong in itself, and so that you only need the tiniest amount in your herbal mix anyway, and you get all the benefits. So it's very low dose herb for the amazing punch that it gives you for its skill base, for what it does. It's incredible. And
who does? A lot of people have got stress these days.
Oh, yeah, who hasn't got stress? So
both bases as well and it's going to address the stress as well.
Yeah, so you've got a couple of others here. So we've got two others on your list. We've got turmeric, which I was saying correctly, and we've got white willow. So I cannot say it. I just call it turmeric. I call it turmeric, and everyone goes, "It's not. You're giving it some extra letters, Mum." My kids, you're giving it's not said like that, Mum. It's not said like that. I'm like, what? What did I say? I can't even remember.
I remember doing the monograph for it, and I was trying to work out how to say it as well. Yeah. I called it turmeric, and there's turmeric, and I was living in Sri Lanka, as you know, for 4 years, and it's turmeric there. I think it just depends on where you come from. It's one of those accent ones, I don't think it's. We can call it curcuma longa.
We'll call it curcuma longa. So there's been a lot of research into it, and there's some good scientific reviews that, into the use of turmeric because it's so popular. It's the end thing.
It is one. It's had a lot of media hype, but it is renowned for its ability to modulate inflammation, and probably because as a society we're highly inflamed. But the inflammation is kind of causing a lot of our diseases, as we spoke about, this chronic inflammation, like the main killers: heart disease, cancer, type 1 diabetes, Anyone with obesity is going to have inflammation. So it's a huge topic, and that's probably why turmeric is becoming this poster herb. And it's associated with an extraordinary spectrum of infectious and autoimmune diseases, arthritis, cancer, digestion, liver health, skin conditions, heart health, type 2 diabetes. It's sort of almost like this cure-all. And probably when we talk specifically about turmeric a bit later on, more about that, about that there are some people that probably shouldn't take turmeric who are very dry because of its antibiotics. It's very drying. Yeah. But it doesn't work like we were talking about before, like your NSAIDs, like aspirin, ibuprofen, Nurofen, and the brand name, or Voltaren's another brand name of another NSAID. But in many ways, it's a bit more sophisticated because it works in multiple ways.
Yeah.
And there is actually preclinical evidence showing that curcumin, which is sort of the constituent that everyone talks about from turmeric. I mean, there's more than 300 compounds in turmeric, but curcumin's the one that gets all the attention, that it can actually protect against the gastric mucosal damage induced by NSAIDs, which is one of the side effects. This is yet to be tested in humans. We have to say that's not, this is preclinical evidence.
Yep.
However, it could be a sign that if you like turmeric with any of these conventional anti-inflammatories could protect against mucosal damage. As well as helping the inflammation itself.
It's amazing, isn't it? It's absolutely amazing. So turmeric's amazing. And what about white willow? That's also on this list of what we should be using. So, and I use it quite a bit, actually. Surprisingly, I use it quite a bit because you kind of think it's going to be scary because of its association with the non-steroidals. So can you tell us more about the white willow that we're all using?
Yes, so it's got a great history actually, along with meadowsweet, because they both contain salicylate, which the liver can metabolize to salicylic acid, which is similar to the core material that was used to make aspirin, chemically manipulate aspirin. And that gave rise to the class of drugs known as non-steroidal anti-inflammatory drugs. Now, the irony is that salicylic acid in the form of aspirin, the chemical drug aspirin, is problematic. It has side effects, gastric distress, and, often when we isolate these active chemicals from a plant, they can have side effects. That's why we like to use whole plant medicine, which is the inherent wisdom of the plant, because they can override these side effects from the one constituent. So white willow, when you use it as a whole herb, doesn't cause gastric bleeding or distress because it's got astringent aspects to it as well from the tannins. There's other constituents in their tannins which make it astringent, and they counteract the side effect of the salicylic acid and modify and modulate the effects to help prevent the gastric bleeding.
Perfect.
So it's nature's wisdom.
Yeah.
And because of the gastric side effects of aspirin, there's been a resurgence in the use of white willow for the treatment of inflammatory syndromes. It's useful for connective tissue inflammation as seen in sports injuries and arthritis, aches and pains. And there are a small number of clinical studies in humans supporting its use in chronic lower back and joint pain of osteoarthritis.
Wow.
Yeah.
It's a great herb, and I definitely use it as well. Not very much, but it's just enough. It really totally has a place on my herbal shelf, I've got to say. Now we really got into turmeric there, so maybe we should just carry on talking about turmeric for a bit longer because it was quite exciting, even though I'm still saying it wrong. So maybe we should let's delve that little bit deeper into turmeric,
because as we were saying, it's one of the most relevant herbs for today's challenges. And in recent years, it's received a lot of hype. It's one of the most studied medicinal herbs. And it's got anti-inflammatory and antioxidant properties, as you were talking about. Sometimes when they're antioxidants, they're also anti-inflammatory. So there's a broad range of anti-inflammatory herbs. Turmeric, it can, as we talked about, it can help prevent a lot of different diseases, and but as a result, it's sort of heavily marketed as a super herb. But it's not for everyone with the dryness, and that's why you see this, the hipster drink, turmeric latte, the golden milk that everyone's drinking. That is a traditional way to have turmeric, so that it's not as drying, because you've got the fats in there with the milk, and often it'll come with black pepper as well, which helps the absorption of curcumin, that constituent we were talking about that has been heavily studied, that seems to have a lot of reaction, or a lower dose for someone who's dry. But if they're very, very dry constitution, then you don't want to have, it's not the best herbal match. Go for another one of the anti-inflammatories. But as I was saying, it's got like more than 300 compounds. Curcumin is undoubtedly the key medicinal constituent. However, there's more to it. And what we're seeing is that there's, we seem to be cherry picking a lot of herbs based on their isolated constituents, and curcumin's like a case in point. Most of the curcumin on the market today, though, has been extracted with hexane and ethyl acetate, acetone, methanol. These are all questionable. They have questionable environmental credentials. And this process also strips turmeric of the synergistic compounds that we were talking about with white willow. And as a result, you'll see these curcumin products that have to be processed further into liposomes and micelles so that they're absorbed significantly. And then we have to have toxicological studies for safety into these. So it seems, why not just use the whole herb? Why not use turmeric as a whole herb, which is traditional herbal medicine, and then you get the benefit of all the other constituents as well. And just remember that each and every one of turmeric's phytochemicals are there to help you achieve success in your clinical practice. And that is across the board with all the herbs.
Yeah.
Chemicals.
Yeah, it's a phenomenal, because it's been traditionally used. It's been around forever. And yet, the last 15 years, 10 years, it's suddenly exploded into you've got to have it breakfast, lunch and dinner. I'm one of the people that can't really tolerate much turmeric at all, but I'm fine with it in food. So I can have turmeric in dinner. I can have a curry, no problem at all, because of course you've got all of the fats and everything else in there. Whereas if I go to have a turmeric latte, which of course normally you buy your turmeric latte, it's not golden milk. They haven't made golden milk. It's the powder. And so it hasn't got all those fats to go with it. So I'll find it very drying. And the same. So it's, for me personally, it's the whole, that whole root. It's not just parts of it. And I can't do the parts of it. And that's explained a lot of why I can't do the parts of it. So, so I'm very much a small dose turmeric, but I can't say it. So I probably shouldn't drink it anyway. Let's be honest. If you can't say so, that is the meme, isn't it? If you can't pronounce it, don't have it. Except for quinoa, eat quinoa.
Oh yeah, you can do that one.
I can pronounce that one. We're all good. So there's a lot going for the turmeric, and I have got turmeric, and I have got a bottle of it on my shelf, and it does go into my anti-inflammatory mixes. So it does stain as well, though. So if we're giving it to our clients, we do need to remember to warn them that it does stain. That's the practical side of this one, and that you don't want to be dropping it anywhere. You need to be a bit careful with it if you've got it in your mix. So is there anything we've missed? Is there anything we haven't said about it?
Anti-inflammatories,
no, there's lots. Yeah. But we are bite-sized. So maybe we'll leave it there for today. Thank you so much, Christine, for coming back and talking to us. It was absolutely great to have you here today. Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.